So this month we're talking about autoimmune, and it's not normal to attack your body, ever. It's never normal. It's common. It's more common than heart disease now. But we're talking about MS today, and MS is basically destruction of the outer layer of your neurons by your own body. And there's multiple ways that can show up. It can show up one incidence. It can show coming and going. There's about 4 main ways that they describe it. Okay, but they all have similar symptoms in the sense that you can have fatigue and pain, but you're going to get some kind of numbness, tingling, or altered sensation because the neurons aren't going to work properly. You can get vision changes. You can get dizziness. You can get difficulty with balance and coordination, memory and cognition issues, weakness, spasticity, like you can't walk, or bladder issues. And this is because the neurons are getting damaged in the central nervous system. So one of the most common ways is MRI for diagnosis, because they can actually see the active inflammation, or they call lesions, combined with myelin basic protein antibodies, as well as maybe like nerve conduction tests. So that's all to say, that's the what's so. And if you have MS, you already probably know it. But what you may not know and may not get told is that you don't have to suppress your immune system. So there's disease-modifying therapies that they use in MS treatment, and that's the conventional treatment. These are immunosuppressants primarily, right? What that means is they're going to shut down a particular part of the nervous system. What's interesting about MS is it often gets better in the 3rd trimester of pregnancy. Now, why is that? Because what happens in women in the 3rd trimester is they're making antibodies to give to their baby. So their Th2 part of their immune system becomes more active. And what happens is that causes the Th1, which is the active attack, to settle down. So, and then it gets worse and rebounds after pregnancy. Now, so if you know that, you can start using your common sense to go, that's interesting. But in our traditional medicine system, we don't. We just go, just shut it down. And I'm going to say I don't think that's a great way to do it. And maybe you do too. Or you know somebody who doesn't want to do that. And there are ways to get this into remission naturally. And here's the thing. They don't know why it happens. Nobody knows. Like, it's not like definitive. But I'm going to tell you, we have a high suspicion. And it begins all immune dysregulation, assuming it's not toxin load or trauma induced, comes from the gut being imbalanced. Your microbiome impacts your immune system so dramatically, and we're just starting to study it. We're just starting to understand it, that as they understand and look at it more, it's going to come out and it's going to be very clear that it's in the level of your microbiome function. And if you don't have a diverse and robust zoo, let's call it a zoo, where you have rhinoceroses and toucans and hippopotamuses and giraffes and otters, and they all eat different foods, and they don't want to be killed off with herbicides or antibiotics, right? And they keep things at bay and don't allow high inflammatory bacteria to overgrow or yeast to overgrow, which all cause inflammation. Then the immune system can be balanced, and they directly impact and talk to the brain. So first thing that has to happen is you need to know what's going on in your gut. It's not that simple. It's not just your gut, but you got to know what's growing. So you need a microbiome panel. You need to see what's going on in there. And then how many bacteria are you missing? And those are called commensal or keystone species. And you got to rebuild those. And you can't just take them. You have to feed them. You have to nurture them. You have to inhibit the other stuff. You have to make sure you have the nutrients you need and all the things that we do in functional medicine. So I hope that's helpful. All right. If you have MS, I'm sorry, it's a real booger of a thing to manage, but you can, and it can be managed well. So